I'm Dr. Dana Udall-Weiner, and I'm glad you're joining me today. If you're watching this video, chances are you're having some doubts about whether your child's eating disorder treatment is working. The great hope and optimism you probably experienced at the beginning of treatment may have started to wane over a period of weeks, months, or even years. Perhaps this is because your child has not made obvious changes in her behavior. Or if she has made changes, you might find yourself wondering if this is as good as it gets, or if she'll ever really be able to defeat her eating disorder. Today, I'm going to talk to you about what treatment generally looks like and tell you why it sometimes seems to stall or even fail. In part 1 of this video, I'll describe the physiological factors that can get in the way of progress. Then, in part 2, I'll go over the psychological, therapeutic, and environmental factors that can get in the way. This information will help you establish realistic expectations and help you evaluate whether the current treatment is working. Ultimately, you'll be able to use what you've learned to talk with professionals and to make informed decisions about your child's care. Before we dive in, I'd like to ask you to complete the worksheet entitled "What Might Have Been versus What Actually Is: Evaluating the Reality of Treatment." If you haven't already downloaded this worksheet, please pause the video now, download it from the link above the window, and print it out. I'll read the questions now, and then I'll ask you to stop the video so that you can have the chance to write down your thoughts. 1. When you think back to when your child was just beginning treatment, how did you envision that things would go? Do you remember having particular expectations about what treatment would look like? 2. How long did you imagine that it would take for your child to start to get better? 3. What type of relationship did you expect to have with her treatment team? In other words, her therapist, physician, or dietitian. 4. Were there any particular hurdles or difficulties you anticipated? 5. How did you come up with your expectations? In other words, where did they come from? A book, a movie, a conversation with your child's therapist? 6. What has been the reality of your child's treatment? How do you believe that treatment has gone? 7. How is this reality different from what you expected? 8. How do you feel about any discrepancies between what you expected and what has actually happened? Please stop the video now and take as long as you need to write down your thoughts. When you've finished writing, press play and the video will resume from this point. Thanks for taking the time to do that. This writing exercise is useful because it can help you gain clarity about your expectations and begin to assess whether they're realistic. In addition, it can help you identify the source of your expectations. Parents frequently tell me that their ideas about treatment came from hearing the stories of other people. For example, one parent told me that she expected that therapy would take about 1 year because that's how long it took her neighbor's daughter to get better. In other instances, parents base their expectations on books, movies, or journal articles which describe the process of recovery. Learning about the experiences of others can be extremely useful to parents, but there is a downside as well, and that's due to what psychologists call the anchoring effect. Anchoring happens when we hear a number, such as the number of months it took a person to recover, and use that number as the basis for our own expectations. Now, anchoring is a normal phenomenon, one that we're all subject to. And many parents come to rely on these numbers or anchors as a way to manage the anxiety that comes with not knowing when or even whether a child will recover from an eating disorder. Numbers can provide parents with a sense of security and stability during a process that is vague and uncertain. But the length of time it takes to recover from an eating disorder is not something we can accurately predict in advance because there are so many variables that both contribute to the eating disorder and that relate to how it is treated. And even in well-controlled empirical studies, data doesn't always predict what will happen in the real world. So part of my purpose in developing this video is to help parents understand just how complex eating disorder treatment is and how many factors can impede the process of recovery.